The story of the CREST Network is really a story of collaboration. It started out as a small group of like-minded physicians who were interested in asking questions about how they might improve care within the emergency department.
The Kaiser Permanente CREST Network, which is clinical research in emergency services and treatments, started in 2008, and we started with 4 emergency clinicians across the region. We've grown over the last 10 years. We now have 11 emergency physicians representing a total of 14 facilities across Kaiser Northern California.
Kaiser Permanente comprises 4 million members with 1 million emergency department visits a year and 700 emergency physicians. With a unique health record, caring for our patients that's longitudinal and integrated.
The potential to make a difference is there. There is so much data that is being collected on all these patients. When you look at it collectively, then you get a better idea of what are the problems, and you might have an idea of what a solution could be. The idea was to design a system or a platform where you can collect data from the electronic health record. We got a grant to build this application called RISTRA. RISTRA stands for Risk Stratification. And the idea is you take past data, looking at thousands of patients, and come up with a risk stratification tool and make that into a software application.
Sits on top of KP Health Connect and is seamless in terms of its interface with Health Connect so that our users don't even realize they have left Health Connect. It brings in information specific to the patient from the vital signs that may be present in the emergency department, from their problem list, from their medications, and makes it extremely easy for our clinicians to click through and then, in cases where we are then providing decision support, get immediate information about risk for that patient and/or recommendations.
Based on that information, we provide the physician that decision support. It's called clinical decision support. The idea is physician will look at those numbers, look at the risk score, and make a decision on the treatment of the patient.
That incredibly powerful information to make those important decisions is put in the hands of the clinician at the bedside within a few seconds.
The key aspects of RISTRA is that it's voluntary on the part of the clinician. It's in a format that gives them something back in return for their investment in the form of decision support, and that it's easily modifiable and that we can be responsive to not only the feedback of the clinicians, but also to the evolving data that's coming out in real time from our studies.
Dustin, where are we with the stroke telemedicine study? As a group, we meet once a month at the Division of Research, and once a month we meet by phone. And we review each person's research projects and how we can collaborate and help each other.
We've covered a variety of topics. Adults with pulmonary embolism, which patients are at low risk for complications and safe for outpatient treatment.
We have looked at a number of things relating to head injury, including pediatric head injury, as well as adults with head injury who are on anticoagulants and their risk for having a bleed in the emergency department.
Another study we did was looking at low-risk chest pain. And we looked at the demographics within the Kaiser Permanente Northern California population, found risk strata that differentiated patients, and applied that to the RISTRA module to take clinicians both through an appropriate workup and a risk concordant disposition decision that has really had, I think, great success.
Looking at our practice in the past when it comes to children with abdominal pain and suspected appendicitis, and how we've been using diagnostic modalities, including CT and ultrasound.
And there are more: cardiac arrest, cardiac dysrhythmias like atrial fibrillation, atrial flutter, and ventricular tachycardia, different traumatic injuries.
The collaboration with the Division of Research is an integral element of the success of CREST. We work with biostatisticians and health researchers who help provide essential support on methods and analyzing the data.
The CREST Network has, by this time, over 80 publications between 2010 and 2017. So they are, to put it mildly, a very prolific group. They have managed to put the group ahead of the individuals and elevated everyone by doing that. It's a story of the power of collaboration. Just amazing.